Good morning. Can I get a quick hands up that we have good audio? Great. Thank you so much. Thank you for joining us for this webinar on restaurant safe reopening with presenter John Northrup. Your host is the Niagara Small Business Development Center, and also joining us today is Center Director Lynn Oswald. I'm your moderator, Renee Goodnow from the New York Small Business Development Center. John has provided 5 documents you can download right now in the handouts section of your GoToWebinar panel. He's also provided a useful link to the CDC website, which I'll also put in your chat box. As questions come up, please don't hesitate to type them into your questions box. We'll break periodically to answer those, and we'll also have time for questions at the end. And with that, I will turn things over to Lynn to introduce John.
Thank you, Renee. Good morning, everyone. This is Lynn Oswald. I am the director of the Small Business Development Center, hosted by Niagara County Community College, and I welcome you to our webinar. We are able to provide this webinar at no charge thanks to the generosity of the Ralph C. Wilson Jr. Foundation, and we thank them for their support. If you're not familiar with the Small Business Development Center, which we affectionately call the SBDC, we are a nationwide organization, not for profit, and we provide free one-on-one counseling to small businesses. So after this wonderful presentation, if you have any questions that you need direct assistance on, please feel free to give us a call. Our office is 716-210-2515. That's 210-2515. At the end of the presentation, the first presentation, I will also be doing a presentation, and I will have contact information in there that you'll be able to see in case you didn't catch that phone number. And if you're outside of the Western New York area, we will also have information on accessing a small business development center near you. So hang in till the end, and my presentation will also include some very specific resources for New York State guidelines that you'll want to access. So this morning we have a great presenter. John Northrup is a consultant with Resource Management of Western New York. His background of 30 years includes health and safety in the chemical industry, electronics, and food service industry. His training background comes from the American Society of Safety Professionals and the National Safety Council, and he is an authorized trainer for OSHA Outreach Programs. John has been working diligently to stay on top of this ever-changing topic, and at this time, I will turn this over to John.
Very much, Lynn, for that presentation. I'd like to welcome all of you as well, and I'd like to let you know that I'm going to give you the facts as I know them as of 9:03 a.m. on Wednesday, because this information is changing on a not daily or weekly, but almost by the hour change. So we are going to talk about safe work practices, PPE, and in this time of COVID-19. So if you have questions, please do not wait to the end. We are going to take some breaks in between. If you have questions, feed them into the system down in the lower right-hand corner, and then we will take some breaks to try to answer them. The panel we have, we will do the best we can with what we know as of right now. So again, restaurant service, and what's that going to look like as we move forward. So we're going to look at some safe practices and how do we, the effect of reducing exposure and the environment. So you're going to have to recognize that business is changing. I thought when this whole thing started that I was hoping by June, July, everything was going to be back to normal. Well, there is no such thing as normal as we know it now. So we have to get recognizing the fact that things are going to change. And just a quick statement about risk, because we're being told about the risk from the state, from the government, from everybody in the CDC, and there is no such thing as a perfect environment. There are risks that we associate from the time we get up to the time we go to bed and while we sleep. So understanding what are those risks and what can we live with in that existence is really going to help us to make intelligent choices. And what acceptable level do we want to operate in? Because one of the things that you're going to find that New York State is telling us that you must do a safety plan and must have it available anytime it's requested, whether it be from the health department, whether it be from an employee, whether it be from a customer coming into your establishment. You have to have a safety plan on how you're going to do that. And we're going to give you a template that the state of New York has developed so you don't have to create your own part of the elephant, okay? But please understand, what is the acceptable level of risk that we're willing to take? So that is really going to be something we got to think about. And I don't read all these slides verbatim. So when we look at hazards control in the pyramid, this pyramid is being looked at by OSHA. And most of you in the restaurant business think about the health department, have never thought about OSHA. But if you have an employee, as soon as you hire one employee, on your bulletin board someplace you have the Department of Labor minimum wage poster, and on that should be also a poster or a corner that talks about employees have the right to a safe and helpful work environment. And so we got to think about that. And please just keep in mind that as we look at different methods, one method doesn't make us safe. It's a combination of methods, and understanding that PPE is the last line of defense because it's only good if we wear it and put it on properly every time. If we don't, then it doesn't have any effect on controlling exposure to us or to anyone else. So we need to think about that as we move forward. And what are those effective controls that we're looking at? So as we talk about this, this is the hierarchy that has been adopted from NIOSH. NIOSH is the sister company who does testing and works very closely with OSHA and the CDC. And in fact, it is a part of the CDC. So we're looking at elimination. If you look at the the left-hand side here, the most effective, see if my pen will work, to the least effective. And you see that PPE, gloves, all this stuff at the bottom is the least effective. So can we eliminate, or in this case, can we social distance? Can we isolate to help stop the spread? They're talking about substitution, and they said NA, but really there are some substitutions that we can be doing. Some of those substitutions could be changing people out, making it so I've seen many restaurants now, rather than letting people come into the restaurant, they find a window that people can pick up orders. That's a method of substitution. People normally come to the counter, but by doing that or curbside, those are all types of substitutions that we can do. Engineering controls, again, creating physical barriers, and we'll talk about that later on. And administrative controls. This is where your health plan is going to come into effect. What are you going to do about your restaurant? Before you can open your restaurant, CDC says that I've got to go through their website and download what has to be sanitized. If you've been closed for a month, I've got to clean the whole facility in a totally different way than I've done it previously, as well as can I stagger, can I eliminate some of the personnel that we're bringing in before we get to PPE. And so this whole idea of elimination is taking actions to isolate people from hazards. Okay, so you hear a lot of the big name restaurants, I won't mention any of them, talking about non-contact food. So I had to do a little research because I want to see how you're cutting a pizza and you're not touching it. I haven't seen that yet. How do you cut a pizza? How do you serve or make up a sandwich? How do you do something in non-contact? And so the idea of non-contact is really about no contact between you and the customer. Please understand that. That doesn't mean that there's some magical way that you're going to make food and never touch it. It's about how do we eliminate contacting between us and the customer, us and each other in the restaurant business, so that we're not spreading. Okay? And so obviously staying at home, if you're sick, that's something that in the past, I've worked at several different locations, and we used to have people who bragged about the fact they came to work not feeling well because they've never missed a day, and they were not going to miss a day unless they had to be carried out. That's not the new norm, and we've got to teach people, if you're not feeling well, stay home. You've got to stay out, okay? Because if that spreads to somebody else, you make somebody else sick, you could end up having somebody call the health department. They come in, and we've seen where some of the grocery stores and stuff have been stopped in their delicatessens from serving food because they had 2 people tested, 1 was positive, and now you got to do a complete shutdown, clean out the deli, all that stuff before you can reopen. So please keep in mind, part of this is going to be teaching our staff. There's a whole new way of doing business. Limit the number of non-essential people coming into your business. A lot of times people bring things in and out of the back doors. How do I eliminate that? Can they bring it in, set it down? Those types of things, as well as PPE and how do we sanitize it in the process. Online orders, obviously, or using the phone. And I got to think about, is there a third party that I can use that is going to take some of this food and drop it off? Under stage 2, you are not going to be, phase 2, you are not going to be able to allow people to come in and sit down in the restaurant and eat. It's still going to be takeout only as of right now. Sit down in a restaurant is not coming to stage 4 or phase 4. Let me get the right terminology. Phase 4, under recreation, eating and dining is classified as recreation. So that won't come into the last phase, stage 4, and that may not happen until sometime in July or August, is what I'm being told by the health departments. So please keep in mind, this is not going to be something you're going to start up and walk away in just a couple days. Engineering controls. Okay, so as we talk about engineering controls, you got to think about things that are going to help eliminate exposure. Okay, and so whether that curbside service, but again, I've learned from some really good establishments, they have 1 or 2 people who do the curbside. That person is the person who picks up the container or the bag and takes it to the car and delivers it versus people coming into the restaurant. So curbside, I have a couple dogs. I needed to get some flea medication. The vet said you're not allowed to come into the veterinarian clinic. You pull up at one of the 6 spaces we have outside, call us, tell us what spot you're in. We'll bring the medication out to you. We'll take your credit card, run it, and then bring you out the receipt. So business is changing how we are doing business, and we got to change with it. Okay, whether it is popular or not, that's the scope of it. And what about ventilation? So think about vents in your building. If I've got air vents and I've got ceiling fans, I've got floor fans blowing around, I've got to change a little bit how we're moving air. Because one of the things that they don't want is to have people with a virus, particulates being blown through the air. Yeah, there are filter systems that you can get if you've got floor fans. So a great question that was asked last week when we were talking about small businesses reopening, what about ceiling fans? And I've asked the health department in a couple of different locations, and what they're advising is ceiling fans are probably going to have to be turned off. Ceiling fans are designed to break up the airflow and be able to move stuff on the ceiling down to the floor and keep it circulating, but that's not going to be one of the ones you're going to be able to filter very well. But if I have a floor fan, I can buy something like a Swiffer that will encapsulate the cage of the fan so that I'm filtering out small particles. And then creating physical barriers. So physical barriers could be if you have booths across from each other with an aisleway, that you're going to stagger left to right every other customer. Your capacity is going to change in your restaurant. So when we get into this right now, we got to think about staggering. And if we have a plexiglass shield between booths, that may help us in some cases. But what am I doing for my cashier? What am I doing for reservation? People who come face to face with your employees, how are you protecting your employees? I got to make sure that I have some kind of a barrier. So I don't know if anybody in this group has been to the post offices, but post offices now have a barrier around the clerk, and there is a box set off to the side that if you have something packaged that has to be shipped, you have to put it into the box, and then the clerk will pick it up in the box, weigh it, and all you have is a little opening to put your credit cards and stuff through, cash picking up. A lot of places are trying to avoid transfer of cash. Credit card is best because somebody can put it in the machine, put their security code in, pull it back out, and there's no exchange of cash, but we'll talk about cash later on as well. So we got to think about some of these things that are changing. And engineering controls. Can I use disposable? So I hate to sound like I'm bragging, but I like to give personal experiences because I think it helps relate. So for the first time in 37 years, my wife and I celebrated our anniversary last Friday. And it's the first time that the restaurant that I proposed to her, our first anniversary, our 5th anniversary, 10th anniversary, there probably were some dinners in between that as well, and our 25th family anniversary were all done at this restaurant. This restaurant has decided they were closing and they were not going to reopen until COVID is all over with. So we called another restaurant, and with my filet mignon came a plastic fork, plastic spoon, plastic knife, wrapped up in plastic with a napkin. So first time I've ever had filet mignon, and thank goodness we went home and ate it, so I had silverware. But I want you to understand, even high-end restaurants are thinking about what are we doing to protect the customer and how do we guide them. So as people walk into restaurants, a lot of restaurants require that somebody seats you, and that whole idea is under this new normal, you're going to be putting a sign on your door asking people to wear a mask. And as they transfer through the restaurant, you're going to ask them to have a mask on. So because somebody sitting at a table, you don't want to spread any germs to them, or them obviously won't have a mask on, spreading it to you. So what does the mask do? It creates a barrier. It's not filtering out COVID-19. And so we'll talk about that later on as well. And now I got to think about hospitals. If anybody's ever been in a hospital, have you ever had a meal served that was not under a cover? So we may have to think about how do we cover the food in transport so that it's not being exposed to everything that we go by. So we're trying to give you some ideas to think about. You've got to figure out how you're going to do that. But it's going to be involving your employees and the business owners to figure out how we're going to do this. What about cup refills? No longer are you going to take a cup off of the table, having a waitress go to a fountain and refill it. They're going to have a separate cup, new cup, just like you do at a buffet with plates. It's going to have to be a different cup, whether that's disposable, so I don't have to have a large variety of cups, And what about salad bars? So we got to think about this. The whole idea is they don't want, the health department will not permit somebody picking up a spoon and then somebody right behind them taking that same spoon. So if you have a salad bar, we may have to think about, I now need an employee to serve salad parts to the customer so that there's not a transfer of spoon to spoon. Or it could be a buffet, spoon to spoon. Can't do that. You got to have somebody serving up and giving them whatever they want. Okay? And what about the waitress that's been doing this for 30 years? I love going into restaurants around the country, and you can tell somebody who is very experienced of this, because they're bringing food, and on their way back to the kitchen, they're picking up another table, taking the dirty plates and throwing the silverware into a glass, picking up the plates. You're not going to be able to do that. That's transferring of germs, because now when they go to grab the next plate to bring it out to the kitchen, they got to wash, they got to put new gloves on, and they got to bring the food back out on a tray or whatever that may be. So you got to think about, how do I train my people? Because our life is changing, and we either change with it. And my hope is we have so many small businesses that are vital to our country's health that some are not going to be able to adjust. And that's a horrible, horrible thing. What about the person who cleans up the table or cleans up the floor? Sweeping. You're not going to be able to take a broom and sweep under the tables to pick out food particles that have dropped from the table while you have people in the proximity, because that's now putting things into the air. And now when we clean off tables, we also got to clean off seats. Do I need a vacuum that has a HEPA vac filter? That may be the solution, getting a vacuum cleaner with a HEPA vac. So please understand, I'm just telling you what the health department is looking at, and the idea of having postage on the signage, I'll get it yet, on the doors, warning people what type of mask you need to have, and that you need to wear a mask coming in and going to the tables. And what do I have to do? I'm going to inject this thought. What do I do with the person that wants to be defiant? As a business, I got to train our employees. What are you going to do when you have that person who comes in and says, I'm not putting a mask on? What is the company policy? Are we going to refuse them? But please understand the feedback that's going to come, because you could have somebody like one of our small grocery stores where I live refused a person in March for not wearing a respirator into the store. The clerk was trained, we don't serve anybody without a shirt, shoes, and mask on. They were told the person, we cannot. Well, he happens to be on the Common Council, and so he went to the newspaper. They wrote an article, and of course, a couple of days later, it's on the front page. So I got to think, as a small business, how are we going to approach that? Because it will happen. And how are we going to make sure that we can provide safety to the people who are eating and people who are moving through the restaurant? So I got to think about those ideas as well. And requiring employee hand washing for various tasks. So this is going to become a norm. I have been dealing with hospitals. Hospitals are talking about now, from now on, every time somebody comes to visit the hospital, first thing they're going to do is take their temperature. I'm going to suggest to you that you do that for your own well-being, for your employees. And that will come up a little bit later on as well. Checking their temperature. I can't do that for every customer that walks in. Okay, but I gotta think about this. And the health questionnaire, again, that could be a verbal thing. I don't want to have to take time and say, here, you got to fill out 25 questions before you can go punch in and go to work. But I got to think about, what are some of the symptoms and signs? I see somebody's got a runny nose. I see somebody is coughing or sneezing a lot. What are we going to do about that? So I'm just trying to throw out what we're being told, and allowing the number of customers in a location. I got to make sure that they keep distancing. And so you see that with big box, they're counting how many people are coming in, but what do you do when they're passing each other in the aisles and that type of thing? So one of the things that has been spoken about in big box stores as well as your restaurant, do I have some way of moving people through one section, having them leave through an alternative section so that we keep people going past each other to a minimal. So establishing stations for hand washing, again, Perel has come out with some, and I'm not trying to advertise for anybody, you can find that yourself, but some cardboard stations that I can put by the door, and it offers the customer walking in or leaving an opportunity to put some hand sanitizer on their hands before or after they've touched credit cards, touched your machine, all those types of things. All right. Staggering break time, so I don't have a lot of people in a break room. And if you're a small business, you probably don't have 4 or 5 people sitting in a break room at one time. Sanitizing that break room on a daily basis. Okay, again, I got to think about cleaning all surfaces. What about the chairs? What about tables? And so one of the things that I like to talk about is a lot of businesses have done this program called 5S. And what is 5S? Well, the idea of 5S is very simple. It looks at how do we sort, how do we put in order, how do we shine it, how do we standardize it, and how do we sustain it? How do we keep these things in place so that as people are changing things out, that, and the whole idea of 5S tells me that if I'm sitting at the owner's table in the back room, when I get done eating, most people clean up their garbage, I hope, and they throw it in the garbage and they walk away. Now I got to clean the table for the next person. So one of the things that we're asking you to do is I got to start training people to think about the next person. Who's the next person that's going to follow you in? And if I take a minute and sanitize the area in which I sat and maybe do a little bigger area, then that's going to help you as the owner keep things sanitized, so I don't have to have a startup cleaning, a going home cleaning, and something in between sometime. So if we train people, when you get done, I want you to clean up your area. You're going to sanitize the table, wipe off the chairs, blah, 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 get it ready for the next person. So things that I've got to think about that we've never done before. And increase online orders, again, administrative controls, keeping distance, encouraging right here, credit cards versus cash. We know it's been tested many times. Currency is extremely dirty, and transferring nickels, dimes, and quarters from the cash register to people. I don't want to get into any of the horror stories. You've all seen them and heard them. So one of the things that I was asked that I mentioned last week in 2 of the trainings is if you want a way to check how much dirt is being transferred, when you open up your cash register before you start business, obviously, when you're training your people and you have a cash register full of nickels, dimes, and quarters, take a couple drops of different color food coloring and put it in your coin. So you may lift up 6 or 7 nickels and put a drop in there, drop the 6 or 7 nickels back in, move it around a little bit, a different color for quarters, a different color for maybe dimes, and just see when people start doing change, and you're talking about we're going to change how we're doing things, how color transfer starts moving around, and you find on the countertops, on the keyboard, on the touch screen, you're going to find it in place. And you may find it on their hands and arms and face if they've touched their hands and face. Dollar bills. We used to use a color pigment. Well, you can't do that now. But take cornstarch. Cornstarch is not hazardous to the environment. Take a little cornstarch and put it in between a few dollar bills. So go down a couple dollar bills, put a little cornstarch, rub the bills together, go down a few more, put it in there, and watch how you start seeing powder being transferred. And now it's probably going to be colored powder being transferred as you're training your employees. It just shows how it happens that we have all these germs transfer. So elimination, engineering controls, administrative controls, trying to look at how do we reduce exposure to our employees in the process. So this becomes very, very vital in order for us to stay afloat. With that being said, I'd like to take a break here. And Lynn, do we have any questions that we as the panel can answer?
John, Renee here. We did have some questions come in. What kind of filters fit on a ceiling fan?
Say that again.
What kind of filters could you fit on a fan?
On a fan, you can buy, and again, you're going to have to talk to some restaurant supplies and maybe even some of the safety suppliers. It's a disposable netting that goes over it that looks a little bit like a Swiffer sheet, but it's designed with elastic band to go over your fan blades. Ceiling fans, I've never seen anything to put over them. That's what's going to cause a problem with ceiling fans. I don't know of how you're going to control those unless they have something for each individual blade.
Thank you. This person thought restaurants were phase 3, not stage 4. Could you clarify on that?
Okay, Renee, I missed part of that again. I'm sorry.
Oh, sorry about that. So this person thought restaurants were phase 3, not stage 4. Could you clarify on that?
What I was told by the health department, when it comes to people dining inside, the state told me that that was actually going to be coming under phase 4. And again, this stuff is changing because that's classified as recreation. Dining in, and that could change. If that changes, that's great. But I don't have anything here in front of me, and I've got the New York State website pulled up, New York Forward, and I don't see anything about dining in on that particular website. So if dining is phase 3, that's great. But you want to maybe check with the health department.
Thank you. What about outdoor dining?
Outdoor dining, as long as you can separate people, is perfectly fine. It's indoors that they're concerned about, but I got to still have some distance between customers. But outdoor dining is acceptable.
Okay, that's it for now. Thank you. Oh, wait,
Okay.
We had one more come in. Sorry about that.
Okay.
Are food workers going to be able to use stainless steel tables? I asked for wooden tables for baking.
I don't have an answer for that. I don't know that it's going to make a difference. The question really becomes is when I disinfect wood, how long am I leaving the cleaning material on the surface to kill germs? Okay. And if you look at the container, one of the things that I've put on the website is the 6 steps to safe and effective disinfectant. The number 2 statement from the coronavirus.gov says, read the instructions, check use, site, and surface types. So it will tell you on that cleaner maybe how long I got to leave it on. Food service, a lot of times it was 20 to 30 seconds that I got to leave that spray or whatever on in order for it to do its work before I wipe it off. And then clean that surface. I hope that answers your question.
I think so. We had a couple more roll in. So is outdoor dining, just to clarify, acceptable right now in phase 2 with social distancing, or is that phase 3?
I believe that as long as I would check with your health department in your area to see because they're the ones that are going to enforce it. But I believe if you have picnic tables, you will not be able to serve them. But if you would bring the bag or the container out, set it on the table, But as far as them eating it at a picnic table or an outdoor table, I believe that they can do that right now under phase 2.
And John, while you're
That's a lot.
talking, I will look into that myself. The frustrating thing with the New York Forward lookup tool is it only tells you your status up to date. So I will look into that, John.
Thank you very much. Okay.
And that was the last one.
Okay, I would encourage that if you have questions, you think of questions, we're going to take a few breaks in between here. That is really, really important for us because we want to help you. Our panel between Lynn, Renee, and myself want to make sure that we can do whatever we can to make you prosperous. You've taken your time to sit in this class. We want to make it worthwhile to you. So if you have questions, please, I can't guarantee I have all the answers because there's some things that I have read that changed almost overnight. So please understand that. So as we go on, there are some of the things that we had last week, and you may find in your own business under cleaning of areas for physical, biological, or chemicals. Okay, in the food service business, we had to do a chemical cleaning every day. Okay, that typically took place on a 3rd shift. That meant that every mixer, every machine had to be sanitized with chemicals. So if we have people who are doing baking and they're using a hardball mixer, how do I clean that mixer out? How do I sanitize it, get it ready for the next day? So I got to think about all those types of things. And what we're talking about with PPE does not affect what you've already been doing, okay? So what you've already had in place or practices, what you have as a standard is still going to stay in place. This goes beyond and above that. So one of the things that I have to do is I have to do a hazard assessment, or some people call it a job safety analysis, which means involving my employees. What are the hazards with us opening the doors, people walking in? What areas are they going to be able to touch and not touch? And the reason I say involve your employees, many times I find from clients that they'll say, well, you know, you give a real good safety training, a great safety talk, but my people won't do it. My question is, have you involved your employees in the process? Because if employees are involved in the process from the start, the likelihood of them following it, because they had input into it, all right, and not one of them wants to end up getting sent home or losing pay. One of the difficulties I think we're going to find in this time that we're in right now, you got some people who are on, and I maybe should not say this, some people who are on unemployment that may not want to come back to work. And that's a real tough thing right now, because I think most employees like their job, like their employer, and want to get back to work. But you're going to have some that are going to find it very difficult. Now they've been off for a couple months and they're collecting unemployment. Do I want to go back to that job? So I got to think about that. So if I can get employees back to work and have them involved in the assessment, so I got to look at what are the various hazards, from serving food to cleaning up the tables, to how do we transfer materials? How are we going to take cups and refill them? Those types of things. How are we going to do that? I'm going to tell you right now, I believe that you're going to find that the self-serve fountains are going to be a thing of the past. I could be wrong. And I would like to tell you this COVID-19 would end by fall. I don't believe that it's going to, because by fall, you're going to have all the government officials saying, what, we're getting into a new COVID-19 situation with winter coming, just like you're going to get the flu shot. Now you're going to be asked to take a vaccination for COVID-19 as well. So we're going to get pushed right into that, into the winter again. So people saying, I would like to go back to the normal, what you know as normal, I'm going to tell you right now, doesn't exist. There is a no exist. So if I can, and you can find on Google, if you search hazard assessment or job safety analysis, there's a lot of different companies that have a template. I always look for free because I'm a small business. If I can find a Word document or something that has a checklist of things that I can look at, that may help you. And again, you got to look at what kind of a restaurant, what kind of an establishment are you in that process. And so now as we move into PPE, we're going to talk about the introduction. How do I protect my eyes and my face, my hands? Do I need a respirator or a mask? And what kind of body protection do I need? So, whoops, I didn't mean to go backwards. And so one of the things that you're going to recognize is now we have to have the discussion about protection against COVID-19. How do I do that? How do I make sure that we're not transferring a virus that I cannot see? So I always like to use the analogy to biological hazards in very much like electricity. If I ask most of the students in class, if I asked you to take out a ceiling light and the light is on, most people say, I don't want no part of that because there's electricity there. Well, we can't see the electricity. We only see the evidence of electricity because light bulbs are lit. But when I take those light bulbs out or disconnect that light, I have no way of knowing. And anybody ever done electrical work at home, all of a sudden you get a tingle in your hand, then you realize, guess what? There was no way of indicating it, but there was electricity there. That is a physical surge that you feel. But when it comes to transferring germs, there is no physical way of doing that. So this becomes a totally different animal in the fact that I can't see it. Therefore, how do I protect against it? And what do I need to do to make sure that we as a business owner and employees are not spreading it? So that starts with the assessment. That starts with looking at every job task, whether it's transferring of money. So with that being said, you may find that you're going to have one person, and maybe it's the person that hosts or somebody else that's going to run the registers, so that I don't have waitresses or waiters carrying food and now stopping in order to go take cash. And chances are they're not going to change their gloves. They're going to go back to grabbing food. Can't do that. Can't do that. I got to either wash my gloves and sanitize them, or I got to change gloves out, wash my hands, put the gloves on, and go serve food. I can't be changing cash and other things that could be contaminated and now go serve food. And so this training becomes really a very important part of our task as owners and as business people. Is I've got to train my people. I'm not in business, and I have a son-in-law who tells me all the time, I'm not in business to be writing procedures and programs and all this stuff. I'm in business to make money. I have a laboratory that I'm running, and if everybody stays on my way, I can do my job. That's not 2020 COVID-19 thinking. I've got to have things in place or my business could be shut down. And not only shut down, I can be fined in the process that may make it impossible for me to start up again. So this is the things that I've got to think about. And I'm not using any agency as a threat, but it's reality. It's reality of life today. So I got to think about how do we communicate the assessment in PPE. What PPE do we need to have and why do we have to have it? Providing PPE is a responsibility of the employer, according to OSHA. Okay, you have to supply it. Now, if you have a particular kind of mask, you're buying surgical mask and somebody wants to use a Disney mask. I just seen one of the newscasters showing 3 or 4 different Disney masks that he bought. If you decide that you're going to let them do that, that's a business decision that you've got to make. But the fact is, I cannot leave that mask at work using it for a week. I've got to use it for a day or so, and it should be changed out on a daily basis. And I should be taking it home, washing it, letting it be disinfected. One of the things that I'm going to tell you is one of the things you're going to learn is I may need to use peroxide in my wash. Thank goodness it's only 88 cents a quart. But I may need to start using peroxide if I'm using cloth mask or I'm using bandanas or whatever that may look like. So when I get down here to N95, I've shortened this training because N95 is not going to be what most of you are going to use, only because of the fact that it requires a medical evaluation to make sure that my employee is fit to wear it, that they don't have high cholesterol, high blood pressure, other things, claustrophobic, other things that could make it difficult for them to breathe through that filtering face piece respirator. So that's one of the reasons that N95 requires, and yet you can buy them at Home Depot or any of the box stores when they're in stock. But if I am, as a owner, am supplying it, I am required to give them a medical evaluation, and it doesn't mean I have to send them to the company doctor. It means that I got to have a nurse practitioner, somebody who's licensed, that says, yes, we've looked at their family history. Yes, we've looked at their blood pressure, cholesterol, those types of things, and there's nothing that warrants them from being at risk. But wearing an N95 respirator, it is classified as a respirator and makes it more difficult to breathe. And so if I have somebody that's doing a Friday night fish fry and they're sitting over a deep fryer, putting fish in, taking fish out, you are not going to want them in an N95 respirator. But one of the things that are being said, cooking staff is going to have to be protected so that there's no contact. And so I got to make sure that they're not going to sneeze, all these types of things. And what happens if somebody's got a mask on and they decide they got to sneeze? Then I got to change my mask. So these are things that are going to come up that you got to think about. And again, I've been doing this for many years. And when we talk about PPE, one of the biggest fallacies that I find people think that PPE protects them against environments. It doesn't. All it does is create a barrier. My face mask is just a barrier. It's not going to stop COVID-19 from getting to me, but it's a barrier to resist it. Because if you look at the box of 25 surgical masks, it says right on the side, will not protect against COVID-19. You're just putting separation barrier, no different than somebody who uses a lotion on their hands to protect their hands from getting cracked and breaking while they're cutting or cooking. Okay, so it's the same type of thing in that area. So making sure what happens when somebody sneezes or somebody has an itch. I've had this discussion with many people. What happens when you go into a restaurant? And please let me tell you, as I told the store retails last week, if you don't think people are watching, they are watching extremely close to how you're doing business. And they're making a determination, not about how good your food tastes. They're making a determination on how sanitized you are. Because if I've got a clerk that's trying to push her hair out of her face because it's falling down in front of her nose or her mouth and she's using gloves and now she's serving food, that's a total change from what they may have done before. Can't do that. Okay, so all these things that we spoke about before. How do we carry food? The waitress that's been 30 years doing this, carrying 3-4 plates on her arm, can't do that. Unless her arms are covered, you've got some kind of a disposable arm wrap that she can take on and off. I don't know how you're going to be able to do that, because I don't think any of the restaurant or any of the health departments is going to let you do that. It's going to have to be, because COVID-19 is spread person-to-person contact. And so that's why the CDC is looking at no contact deliveries. food is put on the table and they walk away. All these things that that were a norm are changing. And so I had to think about those things as well. So it'll be interesting to see how all this shakes out as we get into making sure that people get served, and we want them to have a good experience. We want them to understand that we are there to serve them, and we're not trying to cut things short. We're trying to protect them in the process. But you do know that some people, no matter what you do, are going to think that you're not doing enough no matter what you do. So bear that in mind. And you know as much as I do, there are some who think that all this is a total waste of time. All of you came with an opinion. All of you are going to leave with an opinion. All I'm trying to tell you is how I see things and how I know things as of Wednesday, June 3rd. So please understand that. And while restaurants are trying to follow up on sanitation and making sure that everything is sanitized, for restaurants with pickup windows and all those things, they got to think about, again, how do we sanitize? So if you have a credit card machine, debit machine that people are using their credit cards, I got to think about, do I have a sprayer? Do I have something? And let me say something about sanitizing. So when you go to a lot of the box stores, you see somebody standing outside and they're spritzing sanitizer across the handles. And what are they doing? They're throwing money right down the drain, because what they're doing is they're wasting a whole lot of substance and getting very little protection. What they should be doing is spraying into a paper towel and now wipe the handles and whatever surfaces you want to clean. Because now all you need to do is wet the paper towel. But I got to do that as training. One of the problems you have as people are moving forward in this vast changing world is the fact that nobody's training them. They're spraying all the sprayer on a shopping cart. And I think you probably have seen Facebook and things on the news where children are being affected by the cleaning agents and creating rashes and stuff. Why? Because they're getting chemicals on the carts and they're not cleaning. They're not wiping it off, so the sanitation that they thought they were getting really isn't there, but they're creating more harm. So, but if you have ATM card slot, then I'm going to make sure that people see us wiping it off. Maybe after every couple customers or whatever, but you better make sure that people see you. So I had a customer had a question last week from retail, is I always did cleaning after people left. Now you're telling me I want people to see me clean. And the answer is absolutely correct. You want to have people see you cleaning because that's going to convince them to come back, because they can see that you're concerned about it. And before you print off a receipt, you may ask, do you want the paper? Because some people don't want the paper, they're just going to throw it in the garbage anyhow. And if they don't need a copy of the receipt, then you don't have to worry about transferring. So eye protection. So eye protection could be in goggles. I'm going to think most of you will not wear goggles. They become very hot, especially if I'm cooking the chicken or deep frying chicken or cooking fish in a deep fryer, French fries. But I may need to look at some kind of face protection to prevent me from dropping sweat into that deep fryer. And so what are some of the things that I've got to look at? And what about eye protection? When I'm reaching in to take a thermometer into a piece of meat or into a roast, what is the importance of that? And again, the idea, most restaurants have fans running in the back because people are hot. And I understand that, but I got to make sure that I do something to protect them from sweat and all those things, and at the same time, be able to make their job feasible, that I don't have bacteria blowing through the air. And our eyes become a great way for us to, because they're already, what does bacteria and mold need to grow? It needs heat and moisture. What do my eyes provide? Heat and moisture. What do my hands provide? So again, if I have an employee that says, you know what, I got this pair of disposable gloves and I've been wearing them for a week, I'm saving you money. They are not. They are costing you money because that person is going to end up with dermatitis and it's coming back against your insurance. So somebody thinks that they're helping you because they're wearing the same pair of gloves for a week. That's totally a myth. They're not, because they're putting their sweaty hands back into those dirty gloves, and it's just creating more sweat. And that's how people end up with dermatitis and transferring of germs. And again, one of the things with COVID, not touching our face, they're taking the gloves off and they're rubbing their face because they got an itch, they're rubbing their eyes, all those types of things in that process. And why do I need eye protection? So I do a lot of training in industry, and I've had, or even colleges, and I've had people say to me, you know what, I've been spraying Windex and I've been spraying all these disinfectants for a year. I've never gotten any chemicals back in my eye. Well, good. Then you didn't have any wind or air moving to cause that. But if I get disinfectant in my eye, I could lose my eyesight. And those are the things that we got to be careful of, because now we're asking people to do it more frequently than they've ever done it. The other problem I got to worry about is this stuff flying around in the air. So again, I got to use this analogy. I'm at one of the stores just recently. There's a breeze blowing, and the employee is spraying, as I said, a 24-ounce or 30-ounce sprayer of cleaner, and that mist is blowing back in customers' faces. It was on my leg. I could feel it all over me. That's why you want to spray in a rag, because it's going everywhere instead of where we want it to be intended to. Okay, so please keep in mind, this stuff is so important. Face protection, how do I eliminate it? What are the engineering controls? What are administrative controls? So safe work practices. Again, if I go back to this COVID-19, which comes from the EPA and the DEC, says that I got to read the container and find out what are the warnings and precautions for me about breathing it, about skin contact, about all these different things. Okay, and please understand, when I talk about chemicals, because we're talking about SDSs, safety data sheets, really important to think about. I'll use the analogy I used last week because I can't make this stuff up. Recently, just before the COVID-19 hit, I went to the barber shop. And while I'm sitting in the barber shop, the barber is a privately owned business. He's been in business for 25, 30 years. His dad was a barber before him. Says to me, I know you do OSHA training. I got a question for you. And I said, what's that? He said, I had somebody from the state come in and they wanted to see my SDS book. I said, what the heck is SDS? Safety data sheets. What do I need those for? Well, you have, think about barbershop. You have tonic that you put on people's necks after you've shaved and cut. You have powder that you're sprinkling on their neck. You may have some type of hair stuff that you put in their hair. For every product he had, the person from the state said, I want to see an SDS for that. And he says, I don't have it. Think about your own business, because you may have aerosol cans of cleaners. You're now being required to have a copy or a book that has SDSs in it for all those materials. And if you can't get them from your supplier, then I would like to help you out. There's a website for that. And you can find more than one. But if you have a cell phone, there's an app called SDS-GHS. SDS-GHS stands for Safety Data Sheets Global Harmonized System. That's the system in which we are now a part of globally, because we transfer and buy things from all over the world. And so that gives us safe practices that we need to know. And the SDS will have 16 sections on it. And whether some things are used or not, every SDS has to be exactly the same. The other thing that he said to me is they told me the picture you have on your license, because in New York State you must be licensed in order to cut hair, is out of date. And he said, you do realize that's the license that you sent, the state sent me. And he looked at the date. It's not even a year old since he updated his license, but the state used the same picture that they had on file that they used before. He had to update that picture. Okay. And the third thing that I never knew, places of cutting hair have to have covered garbage cans. I never knew that. He had a garbage can in the back room where he keeps supplies. They wrote him up for that. So here's a small guy that's got to cut hair. It cost him $600 just for that little visit. And he had to show that he made all the changes that they requested. So if you think that what I'm telling you is not going to affect you because I'm just a mom and pop shop, we're just a small private restaurant, it is going to affect you. So I got to think about maintaining distances between customers and other people and fluids, all these different things. And what about safety glasses, goggles, face shield? Again, more people will probably wear a face shield. Again, lightweight than wanting to have something else. And limited to COVID-19 protection, I can use disposable gloves, but please keep in mind that it's estimated 20% of disabling injuries involve the hands. And when we deal with COVID-19, we got to think about particles. So people changing, doing different things in the restaurant and not changing gloves. If somebody had COVID, they're spreading those germs around, even though they have a barrier on their hand. It may not be affecting them, but they're spreading it to other people. So please, please keep that in mind as we move forward, because I can't see contamination. I can't see germs, but I can get in a lot of trouble because of the effect of it. If somebody comes back and says, I was in such and such a restaurant and I got COVID-19, what are the procedures you use that's going to be able to show? Again, I say this quite often in business. People say, well, why do I need documentation? If anybody's ever watched Judge Judy, what's one of the first things she says? Show me the documentation. Don't tell me you have a clean restaurant. How do you show me? How do you show me you clean the restrooms after so many people every hour? How do you show me? I got to have a checklist or something that verifies that I have this paperwork. And again, if I involve the employees, they're more likely to do it. So if you've got somebody who's creative on a computer, have them do a whatever hours you're open, whether it's 8 hours a day, 16 hours a day, or 24 hours a day, make up a schedule for cleaning of the restrooms and stuff like that on one sheet of paper. So I don't have to have a separate sheet of paper for every day. We don't want to keep cutting down the trees. And I'm not a tree hugger, but I'm just saying, the less the paperwork that you have to accumulate, the better off you are. And why is it that I got to have, again, special Band-Aids and all these types of things for cuts to make sure, again, that I don't have bloodborne pathogens being transferred. So surgical gloves, they provide a barrier between your hands and potential virus. They are not protecting you from the virus. Respirators or a mask is not necessarily protecting you from the virus. It's creating a barrier, and it's just a thin layer so that I can't touch it, okay? And the type of gloves you need is based on chemical-wise, what does the manufacturer recommend? We know that there's a lot of people who have problems with latex physically, so latex may not be an option. Vinyl gloves don't give me dexterity if I pick up vinyl to try to pick up coins. So I got to find disposable gloves, preferably these here, whether they're black or blue or purple. They're made out of different materials, but you typically can get a box of 100 for $10. Okay, and if an employee is doing something where they don't need to have two gloves all the time, they're touching everything with the right hand, then maybe they only wear one glove. So I got to think about that. But I can also wash my gloves while I'm wearing them. All right, so that if I get something on my gloves, doesn't mean I have to throw them out. Can I wash them with soap and water? 20 seconds, just like we have to do everything else. 20 seconds, the time it takes me to sing happy birthday to myself twice, or Yankee Doodle Dandy to myself twice. Why to myself? Well, because everybody else may not want to hear it. But I'm cleaning the outside surface while I'm touching chicken, and I'm putting it into the deep fryer, while I'm battering chicken or fish, and I'm cleaning it off in between. So those types of things. And that was supposed to move. And hand protection, okay? I may need to have some chemicals. If you're using bleach, let me give you one chemical knowledge that I have. Never mix bleach of any form with any other product unless it's recommended on the other product can be mixed with bleach, because Clorox or bleach is one of those materials that reacts with everything, including Dawn soap. So if somebody says, you know what, I'm gonna use a little bleach and I'm gonna use a little Dawn so it cuts the grease, don't do that. That's a chemical reaction, and you could get yourself or somebody else sick because of the gas that it's putting off. Do not mix bleach with anything unless the other product says mix it with bleach, because otherwise you're only asking to have problems. And with me talking about bleach, CDC, different healthcare organizations, fire departments, emergency responders have always been taught that 1 part bleach to 10 parts water will disinfect any surface, 99.9%. 1 part bleach to 10 parts water. Again, doesn't mean I splash it on and I wipe it off. I got to leave it on that surface. I have a mask and I put it in there. I got to leave it in there for a little bit before I clean it and start taking it all apart. But mixing bleach 50-50 does not make it stronger. It just means I can't get rid of the bleach smell, and it's going to transfer to food. It's going to transfer to everything else in the process. So 1 part bleach, 10 parts water will disinfect as a cleaning agent, but I still got to rinse it off and all those things besides. All right, so please keep that in mind. Bleach, don't mix with anything. And what about knives, cutting meat, chicken, all these types of things? Delis, and I was going to look it up last week and I didn't. And I can't remember which is which. But somebody here probably knows, and if you know the answer, you can put that in the comments as well. But slicing cheese and slicing meat has to be done in a certain segment, and I believe that if you slice cheese and then slice meat, it creates a bacteria. I think you have to slice cheese, then slice the meat. If I do the meat first, a bacteria will grow when I start cutting the cheese, and I can't remember. I was going to look it up and Google it, and obviously I can't do it while I'm sitting here for this class. But if somebody knows the answer to that, put that in the comments, because that would be useful. But there is a bacteria that grows if I slice it the wrong way. So, and I might need something like cut-resistant gloves. I don't want to cut my hand. Again, typically I'm only going to need a glove on for the hand that's up against the blade. Why do I need to have a protective glove necessarily in the knife, in the hand that's holding the handle of the knife? I might want a disposable glove there. Okay, so we got to do what makes good sense. What's a good, safe practice? And you're going to justify it by what? Hazard assessment. Okay, these gloves, if I bought these, because a lot of these you can buy now individually. If I bought a pair, they're probably going to cost you 20 bucks. Well, how many pair do I want to go through in the course of a week or a month? And again, disinfect them, okay, so that they work. Why? These are a mesh. These are a metal stainless steel mesh, so the knife isn't going to go through it. Disinfect it. And how do I do that? So the proper way of putting on gloves and removing gloves, according to the CDC, is wash my hands first. Then when I want to take the glove off, I want to make sure that I pinch the cuff. And I want to start to pull it down over my finger and thumb. Before it gets to the end of my thumb, I want to take my thumb and my index finger and pinch the other hand. This scenario in food service I've worked at is not recommended that I put my fingers under my glove, because if I touched any surface of that glove, I just spread that contamination not only into the glove, but also onto my skin. Pinch the glove, just like you did up here with the other hand, and pull it down. And then with the hand that I started with, I want to shove that into the opposite hand, pull my glove off. As now I've pulled the other glove down part way, I can wrap it into a ball, and now the inside is on the outside. That's going to go into the garbage can, and the glove that was contaminated is all inside the glove. It's not on the outside where somebody reaches into the garbage can because, oh yeah, I just dropped my cell phone, I just dropped my glasses, and it went in the garbage can, and now I'm contaminating myself. And CDC says I must wash my hands after I've removed the glove. I must wash my hands, soap and water, 20 seconds after I've removed that glove. But that's the proper way to do it. Okay? Making sure I have the right kind of glove. So I grew up in an industry where one size fits all. Everybody wanted inexpensive. I won't call the word what it's really called, cheap. Everybody wanted to save money. So they bought a foreign glove and one size fits all. That doesn't work today. If you go into a hospital, you have a patient or a family member that's in the hospital. Look at the wall above their bed. What is there? There's a display. And in that box is in that rack is small, medium, and large gloves. I've got to have a selection based on person's hand. And if I've got a big guy working in the deep fryer and he tries to put on a medium glove, all he's going to do is rip them apart. I got to make sure I have different size gloves. And food service says I should always remove watches and rings before I handle any food. Okay, so in the food service business, we were never allowed to have rings. My wife, of 37 years, most of our married life, has never seen me wear a wedding ring other than weekends when we went out. Why? Because bacteria can grow under jewelry, watches, all those types of things, and it also could cut the glove. So I got to make sure that they should be, again, I got to teach the employer why we're telling them we're starting a new practice. But those things should be removed before they start putting on gloves. I didn't say that. CDC tells you that. Okay? This is OSHA's training. And remove gloves if they get torn or start to break. So I got to think about now food service. What about in the kitchen? What am I doing if I got facial hair? That facial hair should be covered up. And will the respirator protect me from that? In some cases, what about my hair protection? So food service have always had nets and stuff like that, pretty inexpensive. According to OSHA, I want to make sure that I keep all surfaces covered. And I'm surprised because in food service that I worked in, happens to be dairy products, you were never allowed to have exposure on your arms. It had to be long sleeves, long pants, because we want to cover as much skin territory as possible. Again, this is things that you're going to have to decide as a business. How far do you want to go? What do you want to protect against? Okay, and as I said, surgical masks are creating a barrier. Most of you will not put people into an N95 respirator. Why? OSHA says if I put them in a respirator, then I got to have them have a medical evaluation as well. But we've heard a lot about N95s, and if you watch people put their mask on and how they wear masks, many people are not protecting anything. because they have them below the nose, they have them up to their chin, they're covering their chin, they have their chin exposed. I got to cover my whole face from the bridge of my nose to under my chin in order to have a good sealing surface. So really, really important. And if you're opening business and you're talking about this, and where does N95 fall into? It falls into the OSHA standard under 29 CFR 1910-134. And many times people say, well, I'm not under OSHA. As I said earlier, you have one paid employee. You are under OSHA. You are covered under OSHA, as well as the health department, and could be many other types of food organizations as well. So last week I gave a long description on how to put a respirator on and off. I'm going to tell you this. In order to put the respirator on, I should be holding it by the straps. And I want to put the straps over my ears, and then I want to adjust the nose piece and pull down or open it up so that I can cover my chin. Okay? Very, very important in that process. If I'm touching my mask, then I'm opening myself up to all kinds of opportunities for infection. So please understand that I hold it by the straps, and I put it over my ears, and then I adjust the nose piece, and we'll go through that here in just a minute. And I don't want to be touching my mask. I don't want to be touching my face. Again, OSHA has no jurisdiction as far as somebody making their own mask, but what is that cloth mask? If I put a bandana on that I can see through, what do you think you're protecting against? Absolutely nothing. If I can see through it, guess what? People talking to me, as it says up here, some droplets. People that are talking sometimes have droplets that come out of their mouth of saliva, any kind of mucus, anything else. Where is that going? It's going on my face piece. And if you think that cotton bandana is stopping it, it's trapping it. That's all it's doing. And if I don't wash it and I'm breathing it, guess what? What am I breathing in? So please understand that. I don't want to make this sound like a horror story, but it's very, very important to understand why we do the things we're doing and what OSHA and other agencies are trying to tell you. So N95 mask. Everybody has seen a half and full face respirator that has dual cartridges that I got to screw on. And often when I do PPE training, I say to somebody, if I have an N95 mask or I have a cartridge filtering face piece, which one's going to protect me against chemicals? Which one's going to protect me if I'm doing a project in my house and I'm going to put up some sheetrock and I've got some joint compound, we got to sand it off and all that stuff's going to go airborne. Which one of those masks is going to protect me? And the fact is they both will. What's the difference? If I buy an N95 mask, it's going to cost me a couple bucks. If I buy a box of 10, they're usually less than $2 a piece. If I buy a rubber or silicone respirator with cartridges, the respirator at any of the big box stores is 40 bucks. Now the cartridge is another 15 bucks. And I'm going to spray paint my child's bicycle. I'm going to do a little sheetrock work in my house. Which one was going to protect me? They both will. But this is going to be a heck of a lot less cost, N95, than if I had to go out and buy a respirator and then learn how to take it apart and clean it. But I got to make sure that I have documentation. Okay, I got to show that I did a training on respirators. How do you put on your mask? So maybe, and I'm going to show you a sheet. There's a sheet attached. Maybe you flip it over and have every one of your employees sign it and date it the day you went over this training with them. This is a respirator. How do you put it on? How you take it off? And I want you to sign it that I showed you. There's your documentation. Put it in the file. You just gave them documentation. Okay? So here's the sheet. You're going to have something similar. So when I go to put the disposable mask on, I wash my hands. I grab it by the elastic bands. I put it behind my ears. I get it adjusted, and now I take the nose piece and I rub that in. And a lot of people who wear glasses tell me, what, as soon as I put my glasses on, my glasses fog up. Then I'm not putting my mask on right, and I don't have a good seal. That's the first thing that it tells me. It should be a snug fit, and if I work it into my nose and I blow out, I should not have air blowing up underneath it, and I may need to readjust it. Okay, and then I want to put it, snug it down around my chin, and when I go to remove, I want to do the same thing. I do not want to touch the front of the mask, but I want to grasp it by the earlobe straps, remove the mask. I suggest you lean 45 degrees forward. What's that doing? It's getting it away from my clothes and it's getting away from my body. So if there is any contamination, instead of grabbing it by behind the ears, now I'm holding it off away from me in order to put it into the trash. Okay? And if it gets soiled, it gets wet, I'm sweating so bad, then I got to get a new mask. And what the hospital tells me is if you are saving a mask, do not store it in plastic, because I own stock in plastic storage bags. I'm kidding. I use a lot of plastic storage bags for new masks. But if you're using a mask over, it's recommended by CDC and the health organizations, put it in a paper bag. So think about the brown paper bag that as a kid carried to school. Whoops, I got to go back one. I should be storing that mask. And the reason being is that that bag is breathable and it's not going to allow bacteria to continue to grow. If I put it in a plastic bag, if there was any bacteria, it's going to continue to grow. And then I got to wash my hands again before I carry on. Okay. And I just I took out about 10 slides. So, but I want to review this. If I'm gonna wear a reusable or disposable mask more than once, I got to make sure that I get fitted for it. If you have a 2-strap mask, and that's why I left this in. It's very important that I grab the mask, fresh, clean mask that was stored in plastic bags, because that's how it comes from the manufacturer. It's stored in plastic. I want to hold it in the palm of my hand, behind the straps. And then I want to grab the top strap first and pull it over the top of my head. Okay? And so I put the top strap on, then I grab the bottom strap and I put it over the back of my neck. Now you see people doing this in every different configuration as possible. You're not getting a seal. This is why OSHA says I've got to train people. Because if I don't do the top strap first and it isn't on the bridge of my head, on the back of the top of my head, then it's not holding the mask in the place where it's supposed to be. And then the other one should be below my neck, okay? And when I put it to my face, then again, I want to cover it up. And one of the things you can tell your employees when you're testing, even with a surgical mask, if you've got a good seal and you cover up the media and blow on it, you're going to know if you've got a leak at the bridge of your nose or not. Then I got to readjust it again. Okay, cover up as much as you can, and that's my mask strap. So, and when I go to take that off, then what I want to do, let me go back to this picture here. When I want to take that mask off, I don't touch the mask. Okay, I want to grab a hold of the bottom strap first, lean forward, pull that up over my head, and then grab it. I'm going to grab it by the straps. And then I'm going to grab the top strap. And again, why? Because that's taking it away from my face as I remove it. Okay? Very, very important. What they're trying to, and then it goes into a garbage can. So the N95, because OSHA training says that I got to tell you what's the difference between an N95 and a P95 or P100. And so what it is, it's the particles, and if it says N, that means it's not oil proof. So if I'm working in a kitchen and I'm trying to protect somebody against the cooking oil, N95 mask is the wrong mask. It's got to be a P, and as I said earlier, most of you are not going to put them in a P mask because it's going to be extremely hot, and I may be carrying my cook and stuff out. But please understand, what does that P stand for? And so it's going to keep out 0.03 microns or larger particles, and that's what makes it 95% efficient or 99.95% efficient, and it's designed to be used for one shift, okay, in that process. And there's a lot of misinformation out there about respirators, and so that's why we're trying to make sure, OSHA wants us to make sure that when we do this training, that we train you right, so you have a knowledge about it and you can train your employees, because well-educated employees make my business more successful. That simple, okay? And that's what an N95 mask looks like. Okay. Are there any questions?
John, yeah, we have a lot of questions. We need to clarify something that was discussed earlier. I have not found anything on the New York website that says you can have an outdoor patio open. John referred to people taking out food and maybe sitting at a patio you have in your yard. I've seen that at some of the ice cream stands. People get their ice cream cone and will sit out on a picnic bench. But who's cleaning that bench in between people? So be very, very careful. There'd be no outdoor service where you have a waiter or anyone. They're taking the food and they're possibly going to a table. I don't think it's recommended at all to open a patio, even if you can socially distance. It specifically says on the New York website, takeout and delivery only.
Okay.
And what phase it's in, I'm not seeing guidance on that. I would err on the side of caution and say indoor dining will be phase 4, because phase 4 is clearly about crowds and controlling crowds. So that would err on the side of caution there about reopening. Somebody asked about weddings, banquets, showers, the same kind of thing. Anything that involves groups of people is going to be an issue. John, somebody commented that they liked that you were talking about including the employees. I think that's a great point. Can people eat at a bar? Not at this time, and I don't know what that will look like when you are allowed to have people in your restaurant. I know I've seen in other states that they are not allowing people to congregate at a bar. Again, that's that social distancing.
That's correct.
Issue.
Yeah, they can't congregate in the restaurant to pick up the orders. Most places have said, call when you get here. We'll tell you when your food's ready so you can come in and pick it up, because they don't want them congregating in the restaurant itself.
Correct.
Yeah.
The safety plan, someone had a question about the safety plan. I will be going over that at the end, so I will bring that up. John, somebody's asking, what if a staff member has COPD issues, and what is that with wearing a mask?
I would have them consult with their doctor, whether they can or not. And the question is, even in OSHA's training, if you have medical clearance that you can't wear a respirator, but the problem is, doesn't mean that you can't transfer germs. So that's going to be an issue that you're going to have to contend with.
Somebody asked if a cleaner must stay on a surface 4 minutes to sanitize. I think that depends on the cleaner, right?
That depends totally on the cleaner. And the only way you know that, if I go back to this 6-step process, it says read the directions. Okay, surface area, follow the contact time. So if it's an EPA regulated material, it's going to give you a contact time. How long can it be on that surface?
Someone is asking how many people can be in a room. I don't know if they mean employees or customers. We know we can't have customers inside yet. We haven't been told. Have we been told capacity requirements, whether it'll be allowed at 25% or 50% when that is allowed?
Again, it's going to be depend on the size of the room, and as long as they can whether they can social distance. Okay, think about registers, people checking out. Again, you're going to have tape or something on the floor distinguishing what a 6-foot distance is. I mean, we know from shopping stores that they say a shopping cart and you behind it gives you roughly 6 feet. Okay, so you're going to have markings on the floor, something we've never dealt with before. But whether it be duct tape or some kind of safety tape to identify to people, I need distance. And I've seen a lot of businesses that are open that have posted signs around the building. You need distance for your protection. Give us the 6 feet distance as well. So sometimes when you go into an area where you got to have people almost face to face, you got to make sure that they can give you some space.
Okay, someone is asking why are nitrile disposable gloves better than vinyl?
Okay, that's a very simple question. It depends on what kind of chemicals am I handling. You said vinyl or nitrile? Nitrile and what other glove?
Nitrile. They think are nitrile disposable gloves better than vinyl?
Yes, because vinyl is nothing more than plastic. Okay, and so that's one of the reasons why you don't have dexterity. It's not designed for any type of chemical whatsoever. And so again, spray paints, things like that, a lot of your, like I say, hospitals, nitrile, rubber, or neoprene, any of those, or even natural rubber will give you better protection than a vinyl glove.
All right, now I have a math question for you. Is the 1 parts bleach to 10 parts water the same ratio as the 2/3 cup bleach per gallon that the CDC recommends?
Renee, Lynn, you're breaking up on your microphone a little bit. So
I'm sorry.
That's okay. Repeat that question again.
Is the 1 parts bleach to 10 parts water the same as the 2/3 cup bleach per gallon that the CDC recommends? Does it work out to about the same?
Yes. Yes.
What about cloth mask that has a pocket for a filter, like a coffee filter? I haven't seen that.
I have not seen them either, but again, coffee filter is not a real filter system, but it protects coffee grounds from going through it. So it must have some filtering properties. And again, from what I've seen from the CDC and from the health department, they're not asking who manufactured the mask and all that. They're recognizing that people are making their own masks. And again, having a coffee filter in there is giving you another level of distancing. It's better than having a bandana over your nose.
Does an N95 mask protect you from bleach vapors?
Does N95 protect you against what?
Bleach vapors.
You won't smell them nearly as bad. It's going to, yes, it's going to eliminate some of it. But again, if I'm doing a lot of bleach for the day, you're going to smell it within 15, 20 minutes because you're going to smell bleach in the water. Okay. Now keep in mind, you can also buy bleach now that is scented. I'm not going to tell you the scented is any more effective. The effectiveness is going to be exactly the same. Whether you smell the lemon or smell the bleach, the lemon may be a little bit more pleasant.
Michael, thank you for your comment. He said he just received communication from the Niagara County Health Department that said indoor dining is phase 3. Now that I'll believe that when I see it, and I'll wait for New York's official guidance on that, but let's hoping it is correct.
Okay.
And,
Well, and that's why
and I apologize if my mic is, someone has commented, not just you, that I'm not coming through clear. So what I will do is when John starts talking again, I'll switch to a headset and see if that fixes the problem.
Okay, that would be great. Thanks, Lynn. Are there any more questions?
I've not had an issue before, so I apologize for that. This is the first time this has come up. So back to you, John. That's it for the questions.
Okay, so I really appreciate these questions because I'm trying to get your answers. And please understand that some of this information is changing. Anything you follow off the CDC is going to be accurate information. But please understand, the CDC has changed what they've said since we've started COVID-19 several times as well. So that's why we got to stay up to date because information changes. So if you think that, I was told 5 years ago such and such, well, that ain't going to be true today. So any questions about that in that process? And please understand, we have people that are very clever. So I got to make sure that I train my employees. And this actually came from COVID website, somebody putting a hole in their respirator so they could go out and have a smoke. What protection am I having? Absolutely none, inside or out. And so we've seen this in industry where somebody has a respirator, they've got to wear it an hour, 2 hours at a time. And somebody will drill a hole in the side of the respirator so they can have a cigarette and they'll put duct tape over it. If you see any respirator in your establishment that has tape on it, you better investigate. Okay, why is there tape? And another thing, I got a nice seal across the bridge of my nose. I'm going to use this picture here. I got a nice seal across the bridge of my nose, but if I've got an opening right there, what am I protecting against? Absolutely nothing, because the air particles that I'm breathing are coming right through the side of my mask. That's why it's so important to understand that I've got to keep that mask close to my face. You'll see in some cases, hospitals and stuff, where the employees are crisscrossing it around my ear to help try to get that better protected. Whatever you can do, but if everybody has a different shape face, that's why under OSHA, we have to fit test people wearing respirators because I got to get the right mask for them. And if you've got a problem with employees can't get a good seal with the respirators you're buying, I hate to tell you this, you got to find another brand. I got to find a different type of mask because if I can't get my employees protected, I'm going to have a problem. Okay? And what about body protection? So it's kind of interesting. I have two sons who live in Buffalo, but I have a son who lives in Buffalo and bartends. Currently out of work, yes. And he bartends for two different large high-end restaurants, one of which has given him a apron to wear when he's bartending. Now, the purpose they did it so he could keep a can opener and those types of things, bottle opener in his pouch rather than putting it in his pocket where he could be contaminating other surfaces of his body. But again, I got to think about this. Well, if I'm a small mom and pop restaurant, just my wife and I start buying every employee this kind of an apron, that could get real expensive really fast, right? Can I buy disposable and will it give me the same protection? What am I trying to do? It's a barrier and I'm trying to keep it off my clothes. I'm trying to keep it from being transferred to whatever I have as street clothes, but whatever I did, if I have pets and I have dog hair, I don't want that in my food. So again, it's making a barrier between my cleaning surface and the other area. So again, covering normal incidences of PPE. Again, can I wash them? That would be the advantage of having aprons. But if I got to have aprons, then chances are I'm going to have two. so that I can have one that's clean and one that gets dirty. If it gets covered with something, and again, this is not my training, but this is long pants, long shirts with long sleeves and an apron. Again, recommend it. What you do in your business, the whole idea is they want to keep things covered as much as possible. And obviously closed shoes, but I don't know who would be wearing high heels cooking in a restaurant. But anyhow, but it could be sandals, I guess, flip-flops. But if I drop a pan of boiling water on my foot, that's really going to burn. So these are things that I got to think about. These are recommendations for employees, okay, as we move forward. Covering as much bare skin as possible. Cleaning and sanitizing is our next step, okay? And now we're getting towards the end of our training, but this is where it really becomes rubber meets the road. I have to thoroughly clean. Again, I mentioned in the beginning about some of these restaurant restoration shows, and how many times have you seen, I can't think of the guy's name, my wife would tell me right off the bat, go in and the filters above the deep fryers are just coated with grease, corners, all those things. Part of the thing that you need to do is make sure that I go in and totally sanitize and disinfect our restaurant from the front door to the back door and everything in between. So again, if you go to the CDC website, there is, and we've added as an attachment, there is a whole list of things that they're asking you to look at and make sure you have cleaned. But I got to clean it on a regular basis. And again, digital surfaces, most mom and pop shops don't have, at least I haven't seen, a card reader where they can do their cash out on their table, but those are available, and making sure that self-service areas, common places and stuff. So one of the things that Lynn mentioned before about outdoor services, ice cream places and stuff like that. I don't know how you're going to attach it, but if you're going to use a disinfectant on picnic tables or something because somebody's going to go sit at a table for your own protection, I would make sure that if you're going to let people sit outside your place and eat, that you have some way of either you got people going out cleaning the tables, or you have some kind of a spray that you let them clean the table. But again, I would be telling people spray it in the rag, wipe it off, rather than spray the area. Because if I've got somebody eating ice cream within 6 feet and the wind's blowing, it's going to be all over their ice cream. And guess what? Somebody's going to buy them a new ice cream cone. So please keep those things in mind. Lemons, things like that. We got to think about how this stuff's going to happen, because we're not going to be able to leave them in a container near a self-serving station. All those types of things. Restrooms have to be cleaned on a regular basis. So you've all been into mini marts and stuff where they have restrooms and they have a sign, or the big box, and they have a sign on the door showing that people have cleaned every hour, whatever that time frame is for whatever they're open. You're going to have to think about doing some of those things. So again, if I have somebody who's good with a computer, let them be creative. It could save you a lot of paperwork, okay? But someplace big enough for them to give a time and initials when they did it. But you better make sure that somebody's actually doing it when they say that. And what about menus? Menus got to be cleaned off. I got to make sure, one of the things they're talking about, if you're using a paper menu, that we don't transfer that menu to the next person. They should be thrown away and give the next person a clean menu. Well, that's going to get expensive fast. So please understand, some of these things are going to cost some money in the process, and that's going to be a cost of doing business. I hate to tell you that, but making sure that we have all these areas covered. And tables, tabletops, keyboards, all these different areas. Again, this is all specified under the CDC, things they got to think about. Not only wiping off the toilets and keeping toilets clean, but what about the faucet and the handles and the sink, the doorknobs? Again, that's probably not what most people do when they go in. Most restaurant owners don't go in and clean all those surfaces every time. What about the telephone? All these different areas, the storage shelves, all this stuff. And I got to teach my employees. Okay, I love asking the question, how long are you supposed to wash your hands? And with all of the information, because I'm still doing virtual training just like this, when I ask the question, how long do people have to wash their hands? And it's been said over and over and over, you'd be surprised that I get anything from 5 minutes to 10 seconds. Well, I always say, I'd like to know who the employer is that allows you to stand at the sink and wash your hands for 5 minutes. Okay, if I get chemicals in my eyes, I get chemicals on my skin, I got to rinse my eyes or my skin for 15 minutes. That's all about dilution. That's about diluting the chemicals so it's not just on the surface, but it's soaking into my skin. That's where the 15 minutes comes from. But most people don't stand at the sink for 5 minutes to wash their hands. Okay, 20 seconds, the time it takes me to sing Happy Birthday, Yankee Doodle Dandy, or whatever tune twice to myself. And then some isolation incidences. One of the things that I have read in New York State, and if one of the other panel members more information on it, if you leave the, whoops, I got to go back. If you leave the state, okay, then I'm supposed to self-isolate for 7 days. So I just had somebody tell me that they went to Ohio and got a haircut. And I have family in Ohio, not far into Ohio, and I thought about doing that. But one of the things that the state, New York State, is saying that I'm supposed to self-isolate if I leave the state. Now, I don't know if that's New York to Pennsylvania or not, but I do know if I go out of state, I go to Ohio, I'm supposed to self-isolate. I isolate for 7 days, 7 to 14 days. So again, CDC recommends face covering. In the beginning, they didn't think you need to face cover, and social distancing. So it's one of the easiest ways to protect people is by alternating. So again, I got tables across from each other, and I put somebody at this table, and then they move somebody over to this table, and then I'm going to use this table at my self-distancing. Absolutely. But that won't come until the 3rd or 4th phase. But this is still going to not let you put a group at this table, put a group at this table, put a group at this table, and a group at that table. Not going to be able to do it. And one of the things I have read on the Startup New York is parties no larger than 10. Now, what are you doing if you're having a birthday party for one of your grandkids? I don't know how that's going to happen, that you can't have a party bigger than 10, but they're saying that there should be no parties larger than 10 at a table. So keep that in mind as well. But as I said, hopefully some of this stuff will have clarity to it later on, and as we get closer to the startup times and when we can put this in. And if I have a driver that comes every day, UPS, food delivery services, then I got to think about, do I have a place where I can stage that food so he can drop it off, and now our employees bring it in from there. And if they've got a sign, again, I'm recommending that every employee should have their own pen, so we're not transferring pens around, okay? And you may have a guest pen or whatever, but every time I got to touch something, and you've seen it at registers and stuff, having some kind of a barrier to protect. And what you don't want to have happen, I mentioned this last week, OSHA says that I have to provide a safe work environment to my employees. What I would hate to have happen is somebody calls the OSHA website or files a complaint against a small business owner that they're not protecting us. And now OSHA sends a inspector in. Chances are they may even come with a health inspector. And one OSHA violation right now is $13,494. $13,494 for one violation. And if it was willful, okay, willful means that you knew it was wrong. It's $134,904. We're talking some serious cash. How many cups of coffee do I got to serve to pay for that? Or orders of French fries or something else? So please, if I have working relationships, and I would tell every business owner, I want to create, if you haven't done it in the past, I want to create a open door environment. You have a problem, come to me. You have an issue, come to me and let them tell you what it is. You may not like it. I do a lot of business with a lot of business owners, and I tell them quite often, you know what? Somebody may come to you and tell you what you don't want to hear. Everybody's watched Undercover Boss and all that stuff that goes on. But the reality is, if I've got an open door policy, I'm going to know exactly what's on the minds of my employees. And the ones that don't fit the system, then guess what? I got to make a decision. But I can't terminate somebody just because I don't like them. I mean, under New York State law, it says you can, but you might want to, finding good employees is hard to, so I gotta limit the contact between our guests and our staff. That's my whole point. I gotta make sure, if I've got somebody who's coming in and you know the customers, you've got somebody who's touchy, who wants to give a hug to your waitresses and stuff like that, can't do it. Can't do it. Give the foot kick, right foot to get right foot, elbows, whatever you got to do. You may have done it in the past. You may have allowed it in the past. Can't do it once you open today. Can't do it. Because if somebody else sees it, turns somebody else into the health department, takes a picture of it, whatever. If you don't think people are watching, just look around, because every place you go today, people will have their phone on, people are talking. So it's really, really important how we treat our guests and how we provide services to our guests. And cleaning is one of them. Limiting our staff situations, right? Making sure that we have communication boards or whatever we need to do. And then best practices. Be healthy, stay clean, disinfect. No contact, okay? Whatever we can do to keep that distance. And if I'd like to tell you, if you can set the tray on a server and let people take their own plates off, I don't know how that's going to work today. I have not seen any information on that, but that's why they're trying to do the pickup and delivery, okay? And as we spoke about, if I go to New York Forward, there's I can put in the county, I can put in what kind of business, because it's going to ask you what kind of business are you, and when I pull that up, it's going to tell me all the things that I can do. But that's under New York State Forward, and that plan is under there. Okay, I thought I had the website right there. Make sure you completely disinfect. Again, the website for the guidance of reopening under the CDC, that's the website for it. And will you offer curbside services? Do I have a window that I can prepare where people can walk up and pick up their food? Could be very, very valuable for you today. And install barriers. So we came to an environment where we want to have open seating and all these different things, and now we're being told that that's not. And I was going to download it. I can't show videos on this very well in this type of setting, but there's a video now for industry that they're actually telling you.
John, can I interrupt you for a second? I'm sorry. The server lost connection and it booted you from showing your screen.
Oh, I'm not sharing my screen? Oh, hang on a second.
Let's double check the audience view. I don't think it was your fault. GoToWebinar server went down. Can I get a quick hands up from attendees that they can see John's screen now?
No, I just took it down.
Okay, great. It looks like
they're still getting it?
Yep, it looks like we're good to go. Thank you. Sorry about
Okay,
that.
no problem. I saw that little icon too. So New York, if you go to the website, and it is called New York State Forward, you'll see the plan. That's the safety plan. It's actually forward.newyork.gov. And I can put in Niagara County, I can put in whatever area I'm from, and it'll tell you Western New York, and what are the limits and restrictions and all that good stuff. But the safety plan is in that. It's one of the highlighted things, and all you got to do is fill in the blanks. But it does have to be accessible to any employees, curbside, and barriers, and again, finding PPE. So one of the things that I mentioned last week, I know a lot of the big box and a lot of restaurant supplies are having trouble getting PPE. You might want to think about some of your local hardware stores and stuff. A lot of them still have a pretty good supply of boxes of gloves, disposable respirators or masks. And if you've got somebody in your business that can make masks, and I like the idea of the coffee filter. I just don't know. It should be full. I would think the coffee filter would be folded up. And again, it's about layers to give you more protection. Okay? And we will get through this. That is an important thing. Please understand. I know this is really hard for business. I fear it. I'm so glad that I'm retired. I fear how some businesses are going to recuperate from this, but we can get through this together. Everybody's got to play by the same rules, and you've seen in places in Niagara County and Buffalo stuff that have not, and businesses have been fined or not going to be allowed to start up after this is done. So any questions?
All right, John, can you hear me better now?
Yes, I can. That's great.
Oh, great. I switched to a different headset, and I apologize earlier. I didn't realize my headset wasn't working well. Okay, so I think there is still some confusion about what phases we are talking about. So in my chat, I did say that for phase 2, the following remains closed: dine-in and on-premise restaurant or bar service. All you are allowed at this point is takeout or delivery for off-premises consumption. Off-premises consumption. So I'd be really worried about having them sit out, even if it's a picnic table just out in your yard. Personally, I think that is not included. Whether you'll be allowed this in phase. Excuse me?
I said that's why I asked you if you could maybe check, because I have seen some places
from the
with
New York website,
and people are sitting at them. So
yeah. Okay, we do have one last question. What is the minimum CDC or OSHA mask standard for restaurants, specifically for restaurant workers? What is the minimum they have to do?
OSHA has not set a minimum, and I don't know. You would have to Google CDC. You would have to go on the CDC website and Google it and see. But I believe if you're using cloth, they want some kind of protection between the person's nose and mouth to other people. I don't know. Again, if you're looking at protection, the more layers you have, the better off you are as far as protecting from virus. But any protection is a barrier as far as your employees are talking one-to-one. They're not going to spread it to somebody else quite so much, because it's going to get caught up. And I'm more worried about cleaning and change out than I am about them having the mask on in the process. Because if I'm wearing the same mask 2-3 days, I have absolutely no protection whatsoever. And if somebody got the virus on there, I'm breathing it.
Mm-hmm.
So.
Okay, John, if you can stop sharing yours, I should be able to then share mine.
Okay. Let me go here and see if I can. Okay,
Lynn, I just made you the presenter.
Okay. And
here, yep, you're up.
Are you seeing my slide?
Yep.
Okay, thank you, John, for all of that great information. And you can still type in a few more questions if you need. I'm again Lynn Oswald, Director of the Niagara Small Business Development Center. If you missed our very beginning intro, we are a not-for-profit that provides free one-on-one counseling to small businesses in the Western New York area. I want to point you to a great resource, the Niagara County website, and we will be sending this presentation out afterwards. You will be able to then click on directly at this link where it says county site. They have been doing an amazing job of keeping this information current. I know one of our listeners said that they heard from the health department directly that indoor restaurants will be phase 3. I still think that's optimistic, but if you are ever in doubt, check out this county site. They're doing a wonderful job of keeping that current. So what are the New York State requirements? You have to follow the phase reopening timeline, which for restaurants right now is takeout and delivery off premise only. You must comply with your industry summary guidelines, and New York State does refer you to the New York State Restaurant Association information, so I did put that in the chat box. You must complete and print a business safety template. I'll show you what that looks like. And you must complete an online business affirmation form. So this is what an industry summary guideline looks like. This is a construction example. You'll see that there's a mandatory column and a recommended best practices. You must do the mandatory column. Now, the recommended best practices, you're going to customize that to your situation. But as John alluded to, your customers are watching. And I think when we choose restaurants down the road, it's not going to be just based on how much we love the food. It will be based on what we think is the safest environment. So definitely doing the mandatory and then working through the recommended best practices. If you're in a different industry than restaurants and you've joined us today, you'll find these guides are very similarly laid out with some specifics per industry. John has referred to the New York Forward website, so you can click on that here. You'll see the phase 1, phase 2 information you can click on. You'll see statewide guidelines and essential business information. So what is really key is having your safety plan template. Click on the template link. You can download this. It's 6 pages. You need to complete the entire thing, print it, and have it on hand. If you are asked for it, you can say, here is my reopening safety plan. And John's idea about getting your employees involved in this is so critical. I know some of this is just common sense, but even before this happened, I can't tell you the number of times I've had a waiter serve me a drink by grabbing the top of the glass off of the tray and putting it on the table. And that just always has totally grossed me out. And now it just cannot be done, but yet we see experienced wait staff do these kind of things all the time. So getting them involved in filling out this template, I think will really help them be engaged and see why this is all so critical to the survival of your business. So you don't have to send this template to anyone. You're going to fill it out and you're going to keep it on hand. And you'll see that page 7 has some great additional resources. So make sure you look at page 7 as well. And at the bottom of page 6 of this template, this is what you're going to see. And you are actually saying that you are staying up to date on the guidance. So if you've been open up to this point, the guidance has probably changed over the last couple of months. I know it has changed. Make sure you are reviewing the guidelines, going back to New York forward.ny.gov and making sure you are staying abreast of everything. Now, this is what you're going to do online, and this is for when you are open. Since many of you are currently open doing takeout, you should have submitted this. It's a generic one-page form. You click the industry that you are in, name, address, pretty basic information, but what's really key is that when you submit it, you are affirming that you do have that safety plan in place. So don't just fill this out without having that plan completed, because you are saying that you've done it. If you're considered an essential business, you can look up the list and make sure, see if that has changed. Those of you who aren't restaurant might want to make sure, where do you stand? This list does get updated. And don't assume that if a business that is similar to yours is operating, that means you can also operate. You have to be sure that maybe they had a special circumstance that made them essential, or maybe they're operating illegally. So make sure you know what is right for your business. Phase 1, we're past that. We're into phase 2 with again, some restrictions. Those of you who are in some of these other industries, the frustration is we're not always given what the next phase is going to be. So for barbershops, hair salons, we've been told that it doesn't include tattoos, brow services, eyelashes, facials, but we haven't been told what phase that is going to be in. So when you go on that New York Forward tool lookup, it's going to tell you what it is at this moment. And as we know, these announcements tend to come out at the last minute, and always err on the side of caution and rely on safe resources. Phase 3 does say restaurant and food service on the internet, but again, I don't know what that's exactly going to look like, because there aren't, at least the last time I checked, there weren't guidelines posted yet. And then phase 4. John mentioned the lookup tool. This is what it's going to look like. You can filter by category. If you don't know what your NAICS code is, NAICS is an identifier. You start with industry sector, so you find out your accommodation and food service. Then you look up subsector, and you're a food service drinking place. You look up industry. And then when you get down to this bottom one, it'll say limited service, takeout only, full service restaurant. That's where you'll pick your very specific classification. And you can see, again, your status as of today. And then if one of you is in one of the statewide information, make sure you go to those guidelines here. I can't emphasize enough how you need to stay connected. I have put 3 official websites here. Highly recommend you stick only with either government websites or the New York State Restaurant Association website. You're going to get the best possible information. Watch out for the crazy rumors flying around and, oh, so-and-so told me you can do this and that. Really stick to official sources. The very first one is the Small Business Development Center. It's our statewide link, and they keep that very up to date. New York State website, which we've mentioned, and the Niagara County website that we've already mentioned. If you'd like to work with my organization, our services are free and confidential. You can click on the request form here. If you are joining us from another part of New York State, you can find a center near you at the second link. And I highly recommend you reach out to a local SBDC, because they'll know about programs specific to your region. If you're joining us from outside of New York, that's wonderful. There is an SBDC near you. Go on to the national website, asbdc.org, and you will find, or just Google SBDC near me, and you will find in your state there are these same free services. So that was what I had. Did we have any new questions coming in?
I didn't see any new ones, but we can give it a
not
minute
seeing
if you'd like.
either. John, did you have any last thoughts? Either John's muted or he has no last thoughts.
He was muted, John. You're unmuted now.
I would like to thank everybody for attending, and if you would be so kind to take a couple minutes and give us your feedback on the training presentation today, that would be useful for the college. It's useful for me. So if you would do that, we would appreciate it greatly. And I hope we've answered your questions. There's a lot of questions that, as I said, they're changing so rapidly. Do not listen to Facebook, because if you look at Facebook, you're going to get really messed up. But you should know that. So Thank you very much.
Yes, thank you, everyone. We appreciate you joining us. We will be repeating this at 1 p.m. If you know anyone that you think would like to be joining us, they can go on to the NiagaraSBDC.org website and get the links, or they can call me at 210-2515. That's 716-210-2515. All right, everybody.
Great. Thank you so much, John and Lynn. Have a great day.
Thank you, Renee.
Thank you.